Hey, Dr. Kwan here. I have an unpopular opinion. I'm gonna sound like I'm talking out both sides of my neck. All right, so I think one of the most important aspects of therapy and treatment in general is that we take the client's perspective into consideration. Their preference is super important. And the client is also paying the professional for their clinical judgment. That means that while it's so super important that we take their feedback, their preferences, their desires into consideration, at the end of the day, there's somebody that went to school for a long time, has been practicing for a while, that we have to kind of take their judgment in consideration. So for instance, if I tell you that True Psychotherapy is meeting with me on a weekly, bi-weekly basis if you want to actually make progression as far as your treatment, and you're like, I think I want to see you once every 3 months, then, we can do that, but I'm telling you, you might not make the progress you want to. If I give you some homework that you should do, or I suggest that maybe you do some journaling, maybe you practice some coping skills, do some deep breathing, I give you some things to consider, and you're like, yeah, that's all good advice, but I'm not going to do any of that. And then you're wondering, how come I'm not making the progress I want to make? Well, you got to take in consideration that although you can do whatever the hell you want to do, you're paying me for my professional judgment, my opinion. Now, if you want to talk, we can talk. But if you want to actually make progress and reduce your symptoms, you might have to listen to the professional. And it's also on me to be able to honor your perspective, your judgment, and validate your wants, your desires, your needs, but also find the balance between what do you want and what is actually going to be in your best interest. All right, much love.